This lecture is about the treatment of anxiety disorders. By the end of this lecture, you should be able to answer the question, what therapeutic options are available for anxiety disorders? In terms of the treatment of anxiety disorders, there are non-pharmacological treatments that are actually very effective for anxiety disorders. For example, anxiety disorders are responsive to counseling as well as other psychotherapies. Cognitive behavioral therapy, CBT, is often the most desirable treatment option for anxiety disorders. There are several components to a cognitive behavioral treatment for an anxiety disorder. The first is assessing the cause and effect relationships between thought, emotion, and behavior. The second is increasing exposure to the stimuli or situations that provoke anxiety. The idea here is that without such intervention, the sufferer will withdraw from these anxiety-inducing stimuli and situations. In terms of pharmacological treatments, there are three sorts of drugs that are commonly used to treat anxiety disorders. There are the benzodiazepines, certain antidepressant medications, and a drug known as buspirone. Benzodiazepines are some of the most widely prescribed medications in North America. Approximately 10% of adult North Americans currently take these drugs. Examples of these drugs include Valium, also known as diazepam, and also clonazepam and Ativan. In addition to being used for the treatment of anxiety disorders, they are also commonly prescribed as hypnotics and anticonvulsants. That is, they are prescribed for the treatment of seizures and for the treatment of people who have insomnia. Benzodiazepines have several significant side effects that include sedation, addiction, and a strong withdrawal reaction. For example, there's rebound anxiety and insomnia that's associated with withdrawal from benzodiazepines. Benzodiazepines should usually only be taken for a short period of time, ideally. Most antidepressant medications have some strong anti-anxiety effects as well. Those antidepressant medications with strong inhibition of serotonin reuptake, such as the selective serotonin reuptake inhibitors, tend to have the most potent anti-anxiety effects. So, for example, fluoxetine, also known as Prozac, is often prescribed for the treatment of anxiety. Buspirone is a drug that has the effect of increasing activity in neurons that have receptors for serotonin. This drug has potent anti-anxiety effects without many of the side effects that benzodiazepines have. It tends to be marketed under the name of Buspar.